Kia ora, I'm Gwen McClure, and today on The Detail, the HIV outbreak in Fiji, the rising meth crisis behind it, and why other Pacific Island countries are on high alert.
Methamphetamine use in Fiji at crisis point.
As a result of the meth epidemic, an HIV/AIDS crisis has exploded.
Half of all new HIV cases in Fiji are from intravenous drug use, which is on the rise.
We're seeing young people, teenagers, dying of HIV today. We're seeing 10-year-olds, 12-year-olds coming into clinics testing positive because of drug use.
The problem is even worse than the figures show.
I think one of the things that we have to keep in mind is the numbers of HIV at the moment. It's infections that have happened 2 to 3 years ago. We have high numbers of intravenous drug users now, so therefore, one would assume that the numbers of infections are, larger this year, but they won't be identified until the next 2 to 3 years. I think that raises a really large red flag for Fiji of what's coming over the horizon.
That's Jose Sousa Santos, an expert on drug trafficking through the Pacific Islands. I'll speak to him later in the podcast about why meth use has exploded in Fiji. But first, let's look at the HIV situation. In January, Fiji declared an HIV outbreak, following 1,583 diagnosed cases last year. Bear in mind, the population of Fiji is less than 1 million.
This is the highest total that I've ever seen. It's a 281% increase from 2023.
Renata Ram is the Pacific advisor for UNAIDS, covering 14 countries in the region. She says their modeling shows there's likely to be some 7,000 people in Fiji who have HIV, despite official numbers being less than half of that. Last year, 126 people there died of HIV-related deaths, an increase of about half again the number in 2023. But again, she says the real number is higher. Sex is still a big transmitter of HIV. There were also 32 cases of mother-to-child transmission, a small number proportionally, but Renata says that number should be 0. And unlike in the past, many people are contracting HIV through intravenous drug use. From those that clinicians can get data from, it's about 48% compared to 43% from sexual transmission. Renata says the landscape of the epidemic has changed since she started this job in 2017.
The HIV epidemic was largely driven by sexual transmission. However, in early 2019, we started hearing sporadic cases of injecting drug use and domestic drug use due to all this drug trafficking that was happening through Fiji. And UNAIDS then was sounding the alarms like, we need to nip this in the bud. We need to do more in this space because we have seen from other countries how once injecting drug use becomes widely spread and there are no needle syringe programs or any other harm reduction programs available, this would become problematic. However, in 2020, we had COVID-19 and there was a lot of distraction from other diseases. And that period of lapse in trying to address this problem made room for more users, a bigger domestic market for synthetic drugs, and this is the situation we have now.
I understand that Bluetoothing is a contributor to this issue. Can you explain what that is to me?
So Bluetoothing is when a group of people who are taking drugs, using drugs together, they get a needle and a syringe. One person would inject themselves with the drug and then withdraw their blood after the initial hit and then share that blood with other people.
Drug-Free World Fiji founder Khaleesi Volatabu says the problem has spread through urban and rural environments in all divisions across Fiji. Ms. Volatabu says the bizarre practice known as Bluetoothing or blasting doesn't work, but people believe they will get a great or different high from doing it.
There's been a lot of sensationalization around Bluetoothing, but it's not the main way people who use drugs actually consume their drugs. It's a very small percentage of people that actually do this. However, it's problematic for many issues besides HIV. You have other blood-borne diseases that could put people at risk as well. one of the major issues with injecting drug use and why this has really contributed to our HIV cases is that purchasing a clean needle and syringe in Fiji is quite limited. There's a lot of restrictions at the pharmacies in terms of buying these. And so what has happened is that people, because of this, are starting to share their needles and syringes.
So you said that Bluetoothing has been sensationalized. It's not the main cause of contracting HIV. So would that be sharing intravenous needles?
Sharing needles is the main cause.
Okay.
So a person who shares needles or injecting drug user is 29 times more likely to get HIV in comparison to other modes of transmission. This is mostly with sexual transmission. So once that is introduced into a community, this is like an amplifier for HIV transmission.
So
right?
the fact that the community, that
Yes.
there's more drug use in the community has amplified this?
Yes.
Okay.
Yes. And also sexual transmission has always been the main mode of transmission in Fiji, and we have low condom use. So with these sort of risk factors in the country, it gives it a breeding ground for any sexual transmitted diseases or bloodborne diseases to thrive. And this is why we are where we are in Fiji at the moment.
And so what is the response to that? Is it a harm reduction response where the government and UNAIDS is trying to provide more access to needles for people, or how do you guys deal with that?
Yes, trying to introduce needle syringe programs is not an easy thing to do. New Zealand leads on this on a global scene and being one of the first countries in the world to have a government-supported needle syringe program. And that was in the 1980s. And I'm pretty sure they would have experienced the same sort of pushback from communities. So over here, because there's a lack of understanding about the benefits of a needle syringe program, so there's a lot of advocacy and lobbying from UNAIDS and other UN partners on a needle syringe program. And the government is pushing through with trying to introduce needle syringe programs into Fiji. And there are plans that are underway. And hopefully by the end of this year, we do have needle syringe programs introduced at a small scale while we try and step up with the coming years. The government is taking ownership of this problem. Just last week, the government announced $10 million towards the HIV response, which is a very strong signal of their willingness to do something about the HIV situation.
And what kind of treatment and help is available for people who have HIV?
So the Fiji government provides free antiretroviral medication to any person living with HIV in Fiji.
Are people accessing the treatment that's available?
People are accessing the treatment that is available, and these are people who know their status. However, with the numbers, the 1,583, only 55% of these cases are actually enrolled into care, meaning that there's a large number of people who do not know their HIV status or who are lost after being tested. And this is due to a very large turnaround time in terms of getting your confirmatory test. So usually here in Fiji, what happens is that you get a first test, which is a screening test. If it's positive, it has to go through another leg of testing where bloods are collected and sent to a centralized lab to get your confirmatory status with a more sensitive testing method. And usually during this time of sending the blood samples over, getting the test done in the lab and coming back to the point where the test was requested, there's an average of 22 days. Also, there's that element of stigma and discrimination, which is still very high here in Fiji. So these are some of the issues of people not accessing treatment.
Is this confined to Fiji, or are we seeing rising drug use and rising numbers of HIV across the region?
We only have a very little anecdotal data to suggest that there is injecting drug use in other countries, and this is like Fiji about 6 years ago. We know that from various drug trafficking reports that drugs are trafficked across the Pacific. And when this is like the entry point of creating domestic markets in various countries, because most people who help out with drug trafficking don't get paid in cash. Mostly they get paid in surplus drugs, and this is how people need to make money. They create the domestic markets in countries. With that, we can see early stages of a possible problem. And another thing we need to take into account that HIV testing in many of the Pacific Island countries is very poor and very low. So we do not know the true picture of HIV in all these countries. However, we have the Solomon Islands that have started to report more cases. Vanuatu is another country. Tonga has reported an increase of cases as well. So these are countries that we are monitoring, right? And in the other countries, late diagnosis is not very strong. So people could be dying of AIDS and we do not know because they present with other infections. So there's a lot that we need to do in the Pacific, and the time to act is now.
Does this worry you that we're headed toward a full-blown crisis across the region?
It does worry me. We have all the risk factors in all the countries that could be another possible crisis like what's happening in Fiji. However, a lot of advocacy has been done in terms of the Pacific health security landscape, and other Pacific Island countries are really wanting to do more. And however, one of the biggest drawbacks is that there's not enough resources to match what they want to do.
So drugs are behind the HIV crisis, but what's behind the drugs crisis? Jose Sousa Santos is the lead and convener of the Pacific Regional Security Hub at the University of Canterbury.
This is linked to the drug trafficking of methamphetamines and cocaine through the region from the Americas with the cartels and the South American drug syndicates through the Pacific towards Australia and New Zealand, and from Southeast Asia through the Pacific towards Australia and New Zealand, whose markets are seen as the cash cows of the region. Even though they have small markets, they pay some of the highest prices for these drugs in the world.
He says it used to be that cartels would use one or two elites in the country to move the drugs through. But then that changed. Dealers would be paid in methamphetamine instead of cash, so they could turn around and sell it at a profit and make a lot more money.
It's not the larger cartels that are looking at getting the local population addicted. It's the smaller regional syndicates, the national syndicates, which can now really profit from these smaller markets. For the cartels, the larger cartels, this creates a much easier group of facilitators, so let's say foot soldiers on the ground, to ensure that the movement of drugs through Fiji as the hub is much easier. And it also leads us to see the roadmap towards Fiji in the future, if this is not addressed urgently, of becoming what we call a semi-narco state. We're not talking about a narco state, but where syndicates and cartels have undue and strong influence over the state itself, in where the government will struggle to maintain law enforcement and to counter their influence. That's where having these local markets which support the larger regional syndicate really come in. Having a strong regional criminal syndicate facilitates the activities of the larger criminal entities willing to move drugs through the Pacific. And this is the biggest issue that we have is that a lot of our partners and the initiatives that we see are targeted or perceived as using the Pacific as a buffer.
Okay.
And this is impacting responses by the regional law enforcement architecture.
So the cartels have these local dealers doing the work for them in the islands. The more people they have hooked on the drugs, the more market there is to sell. And the more people they have on the ground working for them, the easier it is to move product through Fiji to the bigger markets, like Australia and New Zealand. Jose says the change has been noticeable in the last 7 or so years, and some of that is down to the deportation of criminals back to their birthplaces in the islands.
From 2018 to where we are now, these local groups evolved, not just in Fiji, but in Tonga and Samoa, and also in the diaspora, to start forming stronger connections. And this is what we started to see at the beginning of what we call indigenous regional criminal syndicates. We're able to feed and grow these local markets and also be involved in different kinds of crimes. And then sometimes, at a smaller scale, be involved in the trafficking of drugs through the Pacific themselves without competing with the larger players, let's say. So this changed as well when we saw the impact of deportees from Australia and New Zealand. Of course, I'm not generalising, but small numbers of deportees which were not able to be reintegrated into society, did not know the language, the culture, as most of them had grown up in Australia and New Zealand, and had lived, some of them which had been lived in a life of crime or had just been released from incarceration. Once they returned to the region, they had no connections in the countries to be able to get work, so they reached back to their contacts in Australia and New Zealand, and started bringing drugs in to feed these markets themselves.
What are we talking about there with deportees? Like 501s or who are you talking about?
The 501s were deported from Australia to New Zealand. Mm-hmm. And we've seen the New Zealand government raise a lot of concerns, and in discussions with the Australian government, how that has impacted New Zealand, and especially how it's impacted the New Zealand criminal landscape. Mm-hmm. By the same token, New Zealand and Australia, but New Zealand also deports Pacific Islanders who have been involved in criminal activity back to the Pacific. So there's a level of hypocrisy there.
And those are people who are often sort of in the same situation as the 501s coming out of Australia, but
exactly
who've grown up in New Zealand, are New Zealanders, and but have a Fijian passport.
Fijian, Samoan, right. Tongan.
Wow, okay.
I've interviewed a lot of these young men, and I still remember one very stark conversation where I had with this young deportee, where he said, I don't belong here. I'm a Kiwi. I just want to go home. And I thought, geez, this is really telling of what the situation is.
My understanding is that Fiji was a stopover on the route and now is kind of more of a staging area or storage spot. What is the benefit to keeping these drugs in Fiji and holding them there instead of just moving them straight through? We
had a seizure of 4.1 tons of methamphetamines in Nadi, and that's definitely not for the local market. The estimates was that amount of methamphetamines was enough to service the New Zealand methamphetamines market for up to 12 months. Wow. And that type of tactic leads us to believe that that would have been utilised as a drip and feed method, so that the traffickers felt comfortable enough to keep such a large amount in Fiji that the infiltration or the influence that they have over law enforcement and other agencies and sectors tasked with addressing this issue was such that it was deemed feasible for them to keep that amount of drugs in Fiji and slowly drip feed into the Australian and New Zealand market.
What's the benefit of drip feeding? Is it just to control prices?
Exactly. It's to control prices, and it's also much easier to get around the measures put in place by law enforcement, in Australia, New Zealand, and the Pacific, to investigate and to seize these drugs. Okay. Where if you have larger amounts being moved, then you lose larger consignments, and that impacts the criminal elements in a much larger way. But this was the first time that we saw that in the Pacific, which is quite troubling.
Yeah, well, and okay, so explain to me why it's quite troubling and kind of what you've just touched on this, but what that says about the police force and kind of monitoring of this situation.
Well, this does show that there is elements within the police force, customs and other agencies which are corrupt or that are involved in this type of activities, and that the syndicates feel that it's gotten to a point now, to a level where they can operate to this, to utilise these tactics, which are new, and really not see that as a high risk change in tactics, and that's really troubling. And I think the current Fijian government and police force are trying very hard to address this issue, to clean up the legacy of corruption in police and in other agencies. But it's a big struggle.
This drug use and drug trafficking, is it having a knock-on effect on other crime in Fiji, like violent crime, for example?
Yes, that's definitely seen. It's had an impact on domestic violence. We've seen a growth in human trafficking, home invasions, break-ins. It impacts all levels of society. This is not just an issue which will impact drug users. It's an impact which take them back to the villages, which erode the influence that the church and other traditional power structures, the chiefly power structures, have over their communities. And this is the issues that the Fijian police are struggling to understand, the tactics utilised by these criminal syndicates and what the impact really is. So how do you really map the overall criminal landscape that's being impacted by these syndicates? When you're looking at the level of domestic abuse rising, when you're looking at the level of human trafficking of young underage girls and boys being taken from their villages into Suva or Nandi for the sex trade. So unless you have quantitative data to back that up and take that to Parliament, to pass new laws, to strengthen legislation, it's very difficult for the police without the right powers to be able to address this. And that's worrying.
As for the health repercussions, Jose says New Zealand can and needs to help.
It's really important for New Zealand to maybe start preparing initiatives on how we can assist the Fijian health sector to deal with this, being in training of more nursing staff, of more doctors, investment in the hospital and district hospitals, because in 2 to 3 years we don't want Fiji to be caught off guard when the number of infected HIV numbers grow exponentially and become much too large for the country to deal with.
That's all for today. The Detail is a newsroom production supported by RNZ and New Zealand On Air. This episode was produced by Alexia Russell and engineered by Jeremy Veal. Thank you to Renata Ram and Jose Sousa Santos. I'm Gwen McClure. Ka kite.